ਅੱਜ ਦੇ ਸੈਗਮੈਂਟ ਵਿੱਚ ਅਸੀਂ ਤੁਹਾਡੀ ਮੁਲਾਕਾਤ ਕਰਾਵਾਂਗੇ ਐਲਨ ਗਲੈਸਰ ਨਾਲ, ਜਿਹੜੇ ਕਿ ਇੱਕ ਨਾਮਵਰ ਫਾਰਮਾਸਿਸਟ ਹਨ। ਸਾਡੇ ਕੋਲ ਇੱਥੇ ਆ ਕੇ ਮਹੱਤਵਪੂਰਨ ਵਿਸ਼ਿਆਂ ਤੇ ਗੱਲਬਾਤ ਕਰਦੇ ਨੇ, ਤੁਹਾਨੂੰ ਐਜੂਕੇਟ ਕਰਦੇ ਨੇ, ਇਨਫੋਰਮ ਕਰਦੇ ਨੇ, ਤਾਂ ਕਿ ਤੁਸੀਂ ਜਦੋਂ ਕੋਈ ਫੈਸਲਾ ਕਰਨਾ ਹੈ ਤਾਂ ਤੁਸੀਂ ਇੰਪਾਰਡ ਹੋ ਸਕੋ। ਅੱਜ ਦਾ ਮੁੱਦਾ ਜਿਸ ਦੇ ਬਾਰੇ ਅਸੀਂ ਗੱਲਬਾਤ ਕਰਨੀ, ਇਸ ਦੀ ਬੜੀ ਚਰਚਾ ਚੱਲਦੀ ਹੈ ਕਿ ਮੂੰਹ ਨੂੰ ਸਾਫ਼ ਰੱਖਣ ਵਾਸਤੇ ਆਫ ਕੋਰਸ ਅਸੀਂ ਟੂਥਪੇਸਟ ਦਾ ਇਸਤੇਮਾਲ ਕਰਨੇ ਆ। ਗਏ ਉਹ ਜ਼ਮਾਨੇ ਜਦੋਂ ਜਿਹੜਾ ਹੁੰਦਾ ਸੀ, ਅਸੀਂ ਭਾਰਤ ਦੇ ਵਿੱਚ ਵੱਖਰੀ ਵੱਖਰੀ ਚੀਜ਼ਾਂ ਦਾ ਇਸਤੇਮਾਲ ਕਰਕੇ ਦੰਦਾਂ ਨੂੰ ਸਾਫ਼ ਕਰਦੇ ਸੀ, ਪਰ ਅੱਜ ਤਾਂ ਭਾਰਤ ਵਿੱਚ ਵੀ ਜ਼ਿਆਦਾਤਰ ਟੂਥਪੇਸਟ ਦਾ ਹੀ ਇਸਤੇਮਾਲ ਕੀਤਾ ਜਾਂਦਾ ਹੈ। ਹੁਣ ਟੂਥਪੇਸਟ ਵਿੱਚ ਵੀ ਇੱਕ ਚਰਚਾ ਚੱਲੀ ਪਈ ਹੈ ਕਿ ਇਹ ਇੱਕ ਫਲੋਰਾਈਡ ਟੂਥਪੇਸਟ ਹੁੰਦਾ ਤੇ ਇੱਕ ਨੈਚੁਰਲ ਟੂਥਪੇਸਟ। ਕੀ ਇਸ ਦੇ ਬੈਨੀਫਿਟਸ ਨੇ ਜਾਂ ਨੁਕਸਾਨ ਨੇ, ਆਓ ਇਸੇ ਸੰਬੰਧ ਵਿੱਚ ਗੱਲਬਾਤ ਕਰਦੇ ਹਾਂ ਐਲਨ ਗਲੈਸਰ ਨਾਲ। Welcome to the program.
Thank you very much, Harpreet.
Thank you. So today we'd like to know from you that, of course, to keep our mouth clean and our teeth sparkling, we need to use some toothpaste. And when it comes to toothpaste, over there also, it's fluoride toothpaste, and then there are natural toothpaste. So if you can take us on this journey as to what is good for us, what is the benefit of fluoride, or any negative impact of this, or as far as natural toothpaste are concerned. So what is good and what is not good?
It's a really good question. And on one hand, we know that fluoride helps us make stronger enamel, number one, which therefore prevents dental cavities. On the other hand, I've seen clinically and in my practice that when people who have a thyroid problem, so the thyroid hormone is low, if they stop using their fluoridated toothpaste and go to a natural one, I just happen to bring Tom's here, their symptoms disappear.
Okay.
And the reason is really simple. When you take fluoride, it's a very highly reactive chemical.
Okay.
It's in the same class as what iodine is, if you've looked at a periodic chart.
Right.
You may not have in a few years, but they are in the same line. And the fluoride, because it's so reactive, will bump off an iodine molecule that we need in order to have thyroid hormone.
Right.
Thyroid is so important because it gives us energy.
Right.
It energizes the whole body and keeps, lack of thyroid leads to your mind doesn't work as well. You have actually a fatty face, you get a hump back, and you get a pot belly because the fat deposition is wrong.
Right.
And your hair goes not as smooth, and it's not very good. Your whole body gets run down, and basically you're gaining weight. And you get depressed if you're not having hormone.
Okay.
And if some people even get goiter, you don't see that hardly anymore because we have natural supplements as well as synthetic thyroid hormones, so people don't get goiter, which is an enlarged thyroid.
Right.
If that is an issue in your life, or you've got a history of people who have lack of thyroid hormone, get off the fluoridated toothpaste.
Okay.
Okay. It's that simple. And when you avoid it, you do have to do a couple other things. You have to floss.
Okay.
Because it's between the teeth. That's super important. Number two, the standard toothbrush that we use, they've done some research, has only so many bristles.
Right.
What we really need is this toothbrush, which actually has thousands of more bristles.
Okay.
And it's soft. If you're using a hard toothbrush, you're actually removing the enamel.
Right.
And then you're wearing at your teeth far before you need to. And the goal, of course, is to keep our teeth as long as we possibly can because they do the best work. So what you're looking for in a toothpaste, I strongly recommend now, don't use the fluoridated one because we know this particular problem. There is evidence that it may even change estrogen levels in women. And I'd be concerned about that, but I don't have a lot of evidence. It's still on the edge of what we do. But if you increase the bristles in each toothbrush and make sure it's soft, you're actually going to brush better. As we age, as there's lots of boomers out there.
Right.
The other thing is we're concerned about our gums.
Yeah.
You can get gum disease if you don't do this properly. So by you brushing with this soft toothbrush at like a 45-degree angle, didn't have to bring one, you can gently massage your gums and remove any tartar there.
Right.
So there's some simple things you can do to make sure you keep your teeth. You don't wear out the enamel. You got to have a softest toothbrush possible.
Okay.
The brand that I recommend is Curifite.
Okay.
It comes in That's a really good brand. Thousands of little bristles, extremely soft.
Okay.
Makes a big
Now,
difference.
when you talk about softness, generally there's an impression in my community which thinks that the more harder you press the toothbrush on your teeth, the better it gets cleaned. So this means it's not good. It can, take away the enamel from there.
That's right. So what we have on a typical tooth is enamel. It's like a hard surface. Like on your car, you've got this shiny lacquer, right? Well, same thing, and if you hit it, nothing's going to happen. When you start brushing, especially with the wrong hardness of the toothbrush, and you're pressing hard, you wear out the enamel. That's bad, because then that means you'll have tooth decay, and you could even lose the tooth, or you have to have it replaced with a crown, which is really expensive if you want to do that. So it is not hardness that makes a difference. Yes, you need to brush, but it's not the harder you brush. If you brush with a soft toothbrush, that's okay.
Okay.
And one with more bristles is even better.
Right.
But it's not how hard you brush, and you got to floss, because actually many of the cavities, they start from between the teeth.
Right.
So you flossing on a regular basis is really important. It's not just the toothbrush or toothpaste, it's getting the stuff that gets caught in our teeth. And here's the thing that happens to us as we age. Our teeth sometimes move apart. It just loses the tightness.
Right.
And then, vegetables and stuff can get caught in there.
Right.
And if they aren't removed, they literally rot in your mouth. You get bad breath, number one.
Right.
And it's not about you brushing your teeth. Number two, when you use the floss, you get rid of that and you decrease your bad breath too.
Wonderful. Let's go for a small break, come back, and also we hear about dry mouth. What is this thing and how to prevent it, or what kind of things are available in the market today? By using that, we can get some relief from dry mouth. We'll talk about this after this break. ਹੁਣ ਤੱਕ ਜੋ ਗੱਲਬਾਤ ਕੀਤੀ ਇਸ ਦੇ ਵਿੱਚ ਟੂਥਪੇਸਟ ਦੇ ਸੰਬੰਧ ਵਿੱਚ ਅੱਜ ਸਾਡੇ ਨਾਲ ਐਲਨ ਗਲੈਸਰ ਨੇ ਕੀਤੀ ਹੈ ਗੱਲਬਾਤ ਫਲੋਰਾਈਡ ਟੂਥਪੇਸਟ ਅਤੇ ਨੈਚੁਰਲ ਟੂਥਪੇਸਟ। ਫਲੋਰਾਈਡ ਦਾ ਫਾਇਦਾ ਇਹ ਇਹਨਾਂ ਨੇ ਦੱਸਿਆ ਕਿ ਇਨਾਮਲ ਸਟਰੋਂਗ ਹੁੰਦੇ ਨੇ, ਪਰ ਜਿਹੜੇ ਵਿਅਕਤੀਆਂ ਨੂੰ ਥਾਇਰੋਇਡ ਦੀ ਪ੍ਰੋਬਲਮ ਹੈਗੀ ਹੈ ਅਤੇ ਨਾਲ ਹੀ ਇਹਨਾਂ ਨੇ ਕਿ ਐਸਟ੍ਰੋਜਨ ਲੈਵਲ ਜਿਹੜੇ ਨੇ ਉਹ ਔਰਤਾਂ ਦੇ ਵਿੱਚੋਂ ਵੱਧ ਜਾਂਦੇ ਨੇ, ਜਿਹੜੇ ਕਿ ਠੀਕ ਨਹੀਂ ਹਨ। ਸੋ ਉਹਨਾਂ ਦਾ ਕਹਿਣਾ ਹੈ ਕਿ ਦੂਸਰਾ ਕਿ ਜਦੋਂ ਬਰਸ਼ ਕਰਨਾ ਹੈ ਤਾਂ ਸੌਫਟ ਬ੍ਰਿਸਲਸ ਵਾਲਾ ਤੇ ਜ਼ਿਆਦਾ ਬ੍ਰਿਸਲਸ ਯਾਨੀ ਕਿ ਜ਼ਿਆਦਾ ਦੰਦ ਵਾਲੇ ਜਿਹੜੇ ਟੂਥਪੇਸਟ ਨੇ ਉਹ ਵਰਤੇ ਜਾਣ, ਕਿਉਂਕਿ ਉਸ ਨੂੰ ਸਹੀ ਵਰਤੋਂ ਉਹਦੀ ਜੋ ਹੈ ਉਹਦੇ ਨਾਲ ਤੁਹਾਡੇ ਦੰਦ ਠੀਕ ਰਹਿ ਸਕਦੇ ਨੇ। ਆਮ ਤੌਰ 'ਤੇ ਅਸੀਂ ਬੜਾ ਪ੍ਰੈਸ ਕਰਦੇ ਹਾਂ ਹਾਰਡ ਆਪਣੇ ਦੰਦਾਂ ਦੇ ਉੱਤੇ ਕਿ ਸਾਡੇ ਦੰਦ ਚੰਗੀ ਤਰ੍ਹਾਂ ਨਾਲ ਸਾਫ਼ ਹੋ ਜਾਣ, ਲੇਕਿਨ ਇਹਨਾਂ ਨੇ ਕਹਿਣਾ ਕਿ ਸਹੀ ਤਰੀਕਾ ਨਹੀਂ ਹੈ। ਇਸ ਨਾਲ ਨੁਕਸਾਨ ਹੁੰਦਾ ਕਿ ਤੁਹਾਡੇ ਐਨਾਮਲ ਜਿਹੜੇ ਨੇ ਉਹ ਖਰਾਬ ਹੋ ਸਕਦੇ ਨੇ ਤੇ ਤੁਹਾਡੇ ਦੰਦ ਜਿਹੜੇ ਨੇ ਹਿੱਲ ਸਕਦੇ ਨੇ। ਨਾਲ ਹੀ ਇਹਨਾਂ ਨੇ ਕਿਹਾ ਕਿ ਫਲੋਸਿੰਗ ਬਹੁਤ ਜ਼ਰੂਰੀ ਹੈ, ਕਿਉਂਕਿ ਫਲੋਸਿੰਗ ਦਾ ਮਕਸਦ ਹੁੰਦਾ ਹੈ ਕਿ ਦੰਦਾਂ ਦੇ ਵਿਚਕਾਰ ਜਿਹੜੀ ਜਗ੍ਹਾ ਹੈ ਉਸ ਦੇ ਵਿੱਚ ਜਿਹੜੇ ਕੋਈ ਫੂਡ ਪਾਰਟੀਕਲਸ ਜਾਂ ਕੀਟਾਣੂ ਜਿਹੜੇ ਨੇ ਉਹਨਾਂ ਨੂੰ ਤੁਸੀਂ ਬਾਹਰ ਕੱਢ ਸਕਦੇ ਹੋ ਫਲੋਸਿੰਗ ਦੇ ਨਾਲ। ਵਾਪਸ ਆने ਦੀ ਜਾਣਕਾਰੀ ਲੈਣੇ ਆ ਡਰਾਈ ਮਾਊਥ ਕੀ ਹੁੰਦਾ ਹੈ ਤੇ ਉਸ ਦੇ ਕਿਸ ਤਰੀਕੇ ਨਾਲ ਉਸ ਦੀ ਰੋਕਥਾਮ ਕੀਤੀ ਜਾ ਸਕਦੀ ਹੈ। ਫਾਰਮਾਸਿਸਟ ਐਲਨ ਗਲੈਸਰ ਸਾਨੂੰ ਅੱਜ ਦੱਸ ਰਹੇ ਨੇ ਕਿ ਟੂਥਪੇਸਟ ਕਿਹੋ ਜਿਹੇ ਵਰਤਣੇ ਚਾਹੀਦੇ ਨੇ। ਬ੍ਰੇਕ ਤੋਂ ਪਹਿਲਾਂ ਇਹਨਾਂ ਨੇ ਦੱਸਿਆ। ਆਓ ਜਾਣਕਾਰੀ ਲੈਣੇ ਡਰਾਈ ਮਾਊਥ ਕੀ ਹੁੰਦਾ ਹੈ, ਕਿਸ ਤਰ੍ਹਾਂ ਇਹ ਪੈਦਾ ਹੁੰਦਾ ਹੈ ਤੇ ਇਸ ਨੂੰ ਕਿਵੇਂ ਇਸ ਦੀ ਰੋਕਥਾਮ ਕੀਤੀ ਜਾ ਸਕਦੀ ਹੈ। ਸੋ ਵੈਨ ਯੂ ਟਾਕ ਅਬਾਊਟ ਡਰਾਈ ਮਾਊਥ, ਐਲਨ, ਟੈਲ ਅਸ ਵਾਟ ਇਜ਼ ਡਰਾਈ ਮਾਊਥ, ਵਾਟ ਕਾਜ਼es ਇਟ ਐਂਡ ਵਾਟ ਕੈਨ ਬੀ ਡਨ ਟੂ ਪ੍ਰੀਵੈਂਟ ਇਟ।
So basically dry mouth is you have saliva glands,
Right.
usually right here, because you get right under your tongue, you can always feel that saliva being produced. There's a number of reasons why we lose that. One, you can have an infection, and that can stop it. Two, medications. There's many different medications, such simple things such as antihistamines. Now it's allergy season now.
Right.
People taking antihistamines. Typically, it tends to dry up your mouth. Two, there's a number of prescription drugs. All depends which ones, but if you see a side effect, dry mouth, that can affect it.
Okay.
And of course, just age. Sometimes as we age, we lose that ability to produce
The saliva.
the saliva.
Right.
So what does that mean to you? Well, in your mouth, that means that your saliva is there to help prevent infection. The saliva is there to help keep down the bacteria count on your teeth in your mouth, especially
Right.
around your gums.
Right.
So when you lose that, one, you can increase risk of bad breath. Number two, you have increased risk of gum disease because you get this what's called a biofilm, or just a buildup of bacteria on your
Right.
teeth. That's why it's obviously good to every 6 months to go to your dentist and get them scraped off, so we don't risk gum infection and stuff like this.
Right.
And number three here, we do have products that if you've lost that ability to make saliva for whatever the reason, we need to help, because
Okay.
you do need to moisturize your mouth.
Of course.
It's really important.
Right.
for good health. So I brought a couple of options.
Right.
And there's not a huge amount. One is just natural saline solution. Some people just spray it in.
Okay.
And you can, saline solutions you buy as contact lens, or you can buy whatever. The other thing is we can stimulate the saliva glands to make more saliva.
Okay.
And you do that, number one, by chewing gum. Number two, by sucking on a candy. But you don't want to suck on a sugar candy, because then you're going to increase the risk, of course, of having cavities.
Right.
The bugs go crazy growing in the sugar. So what we have as a great option is something called xylitol.
Okay.
And these do stimulate, you can suck on it. It stimulates the saliva production, but it's not sugar.
Okay.
And it's safe. It does taste a little sweet.
Right.
But it prevents cavities by that way. Again, lack of saliva means you have an increased risk of cavity.
Right.
So really important. So that's a great product, relatively inexpensive, and you can suck on it whenever you feel like.
Right.
Say something with sugar-free, and it's a lot like some other sugar-free candies where you take too many, you're going to get diarrhea.
Right.
That doesn't count.
Okay.
Okay? Other options. We have mouthwash. This
Right.
Biotin moisturizing mouthwash. You can use that frequently. There is no alcohol in it.
Right.
If you want to carry some. Biotin also makes a spray.
Okay.
So it's
you
a
can just
Biotin
spray also.
spray. So you just spray it in your mouth when you
Right.
feel it's a little dry. Okay? It also makes it looks like toothpaste. And it is toothpaste, actually.
Right.
So this is Biotin toothpaste for dry mouth.
Okay.
Okay, so they have a great option.
Right.
Again, there's a specialty toothpaste called Biotin if you have dry mouth, because you need something different.
Right.
If you don't like a spray or
Okay.
anything else, it comes in like another little toothpaste. It's a gel that you put in your mouth. It's a
Okay.
moisturizing gel. So you just
Right.
squeeze a little out, put it in your mouth, and it'll help moisturize your mouth.
Right. So with that moisturization of the mouth, you can, it helps you absorb the food also much better. Or is it there's some restriction in usage also? Do you use it before eating or after eating, or what?
You know what? You've made a very good point. Part of our digestion process
Right.
is when we chew it in our mouth.
Right.
You need saliva to add water to it.
That's right.
Right? And it's not normal. It's moisturizing. It's just by sipping water when you're eating food, that's a little more difficult.
Right.
But when you have these moisturizers in your mouth, it is going to help you chew the food, wet it before it goes down your throat.
Right.
And it makes it easier to swallow, and then your stomach and down below intestines can digest it better. So that's a good reason why you want to have
Dry,
well
not
moisturized
having dry mouth and having moisturizer in your mouth.
That's fine. You can do that before you eat, or with your eat. Spray it as you're eating, because you
Right.
need to moisturize your mouth. It's going to allow better food digestion.
Thank you very much for this information. Thanks.
You're welcome.
ਸੋ ਅੱਜ ਜੋ ਅਸੀਂ ਗੱਲਬਾਤ ਕੀਤੀ, ਐਲਨ ਨੇ ਸਾਨੂੰ ਦੱਸਿਆ ਹੈਗਾ ਕਿ ਡਰਾਈ ਮਾਊਥ ਦੇ ਸੰਬੰਧ ਵਿੱਚ ਜਿਹੜਾ ਦੂਸਰੇ ਸੈਗਮੈਂਟ ਵਿੱਚ ਇਹਨਾਂ ਨੇ ਗੱਲਬਾਤ ਕੀਤੀ ਹੈਗੀ ਕਿ ਡਰਾਈ ਮਾਊਥ ਕੀ ਹੁੰਦਾ ਹੈ। ਡਰਾਈ ਮਾਊਥ ਹੁੰਦਾ ਹੈ ਜਿਹੜਾ ਸਾਡਾ ਸਲਾਈਵਾ ਗਲੈਂਡਸ ਨੇ, ਉਹ ਗਲੈਂਡਸ ਬੰਦ ਕਰਦੇ ਨੇ ਸਲਾਈਵਾ ਪ੍ਰੋਡਿਊਸ ਕਰਨਾ। ਸਲਾਈਵਾ ਯਾਨੀ ਕਿ ਜਦੋਂ ਮੂੰਹ ਦੇ ਵਿੱਚ ਜਿਹੜੀ ਥੁੱਕ ਆਉਂਦੀ ਹੈਗੀ ਉਹ ਬੰਦ ਹੋ ਜਾਂਦੀ ਹੈਗੀ ਹੈ, ਕਈ ਕਾਰਨਾਂ ਕਰਕੇ ਇਹਨਾਂ ਨੇ ਦੱਸੀ। ਪਰ ਇਸ ਵਾਸਤੇ ਇਸ ਦਾ ਮੁੱਖ ਕਾਰਨ ਕੀ ਹੁੰਦਾ ਹੈ ਕਿ ਸਲਾਈਵੇ ਦੀ ਜ਼ਰੂਰਤ ਹੁੰਦੀ ਹੈ ਤਾਂ ਕਿ ਦੰਦਾਂ ਵਿੱਚ ਕੈਵਿਟੀ ਨਾ ਲੱਗੇ, ਮੂੰਹ 'ਚੋਂ ਜਿਹੜੀ ਬਦਬੂ ਆਉਂਦੀ ਹੈ ਅਤੇ ਦੰਦ ਨਾ ਖਰਾਬ ਹੋਣ, ਇਸ ਕਰਕੇ ਇਹ ਸਲਾਈਵਾ ਜਿਹੜਾ ਆਪਣੇ ਆਪ ਪ੍ਰੋਡਿਊਸ ਹੁੰਦਾ ਹੈ। ਪਰ ਜੇਕਰ ਕਿਸੇ ਵਜ੍ਹਾ ਨਾਲ ਇਹ ਬੰਦ ਹੋ ਗਿਆ ਤਾਂ ਉਸ ਵਾਸਤੇ ਬਹੁਤ ਸਾਰੀਆਂ ਆਪਸ਼ਨਸ ਅਵੇਲੇਬਲ ਨੇ ਮਾਰਕੀਟ ਦੇ ਵਿੱਚ, ਤੁਸੀਂ ਇਹ ਸਾਰਾ ਕੁਝ ਲੈ ਸਕਦੇ ਹੋ। ਇਹਦੇ ਵਿੱਚ ਇਹਨਾਂ ਨੇ ਕਿਹਾ ਕਿ ਟੂਥਪੇਸਟ ਵੀ ਹੈ, ਜੈਲ ਵੀ ਹੈ, ਸਪਰੇ ਵੀ ਹੈਗਾ, ਜਿਹਦੀ ਕਿ ਵਰਤੋਂ ਕਰਕੇ ਤੁਸੀਂ ਆਪਣੇ ਮੂੰਹ ਦੇ ਵਿੱਚ ਉਹ ਸਲਾਈਵਾ ਜਿਹੜਾ ਉਸ ਨੂੰ ਦੁਬਾਰਾ ਲਿਆ ਸਕਦੇ ਹੋ, ਤਾਂ ਕਿ ਜਦੋਂ ਤੁਸੀਂ ਕੁਝ ਖਾਵੋ ਉਹ ਅਬਜ਼ੌਰਪਸ਼ਨ ਵੀ ਜਿਹੜੀ ਹੈ ਤੁਹਾਡੀ ਬੈਟਰ ਹੋਵੇ, ਅਤੇ ਨਾਲ ਤੁਹਾਡੇ ਜਿਹੜੇ ਮੂੰਹ ਦੇ ਵਿੱਚੋਂ ਬੋ ਜਾਂ ਦੰਦ ਨਾ ਖਰਾਬ ਹੋਣ, ਉਸ ਕਰਕੇ ਇਸ ਨੂੰ ਇਸਤੇਮਾਲ ਕੀਤਾ ਜਾ ਸਕਦਾ ਹੈ। ਫ੍ਰੀ ਕੰਸਲਟੇਸ਼ਨ ਵਾਸਤੇ ਤੁਸੀਂ ਸੰਪਰਕ ਕਰ ਸਕਦੇ ਹੈਗੇ ਹੋ ਐਲਨ ਗਲੈਸਰ ਨਾਲ। ਅਤੇ ਇਸ ਪ੍ਰੋਗਰਾਮ ਦੇ ਵਿੱਚ ਹਮੇਸ਼ਾ ਹੀ ਸਾਡੀ ਕੋਸ਼ਿਸ਼ ਹੁੰਦੀ ਹੈ ਕਿ ਤੁਹਾਡੇ ਤੱਕ ਉਹ ਇਸ਼ੂਜ਼ ਨੂੰ ਲੈ ਕੇ ਆਈਏ ਜਿਹਦੇ ਬਾਰੇ ਤੁਸੀਂ ਕੁਝ ਜਾਣਨਾ ਚਾਹੁੰਦੇ ਹੋ, ਅਤੇ ਜੇਕਰ ਤੁਹਾਡੇ ਕੋਲ ਵੀ ਕੋਈ ਸਵਾਲ ਹੋਏ ਤਾਂ ਸਾਡੇ ਨਾਲ ਜ਼ਰੂਰ ਸੰਪਰਕ ਕਰਨਾ।